Judge and Commissioners, good afternoon. We'll
Good afternoon.
talk about the self-funded medical plan. I know this has been touched on a couple of times over the past couple of days, and look, there's no denying that the inflationary hits that the healthcare industry has taken is really driving our medical plan and making it pretty expensive. The handout I've given you shows on the left side fiscal year 23, where we are through July. And then I projected out the last 2 months just based on the averages that we've seen so far. The plan's expenses are going to end the year at about $55.75 million. That's just expenses. We do get some offsets back in that, and for our purposes, any money that comes back to the plan that's not county funding is considered an offset. So that includes your employees and retirees paying their premiums, stop loss, subrogation money, any rebates we get. Right now, we're sitting at about $6.3 million. We anticipate by the end of the year that'll be more around $8 million. So this year's plan is going to end up in the mid 47s million for the actual bill the county is going to have to pay. On the right, you'll see we projected out, or I've projected out, what FY24 is going to look like. We're anticipating about the same increase. On FY22 to 23, we saw just under a 5% increase. I'm pleased to say that we saw medical claims themselves stay relatively flat. In fact, over the past 2 years, they've stayed within $1 million of each other, and it's almost entirely on the back of our Next Level Prime program. We pay Next Level Prime about $2 million a year. Just on urgent care alone, we probably saved 10 to 12 million over that period of time. We've saved another 100,000 in labs. That program alone is keeping our medical claims flat during a time when the industry is seeing probably about 7% inflation. The entire driver, and this is the part I really want to hit, the entire driver on the rising costs we're seeing is our prescription drug costs.